Welcome back to ETAW. Today we're going to be going over a question that we got at our last class. For those of you that joined us, we're very glad that you were there. Question got asked at the end of the class, how do you set up your home first aid kits? And so figured we'd do a video on it, video response to that. And kind of go over and show you my theory or my idea and what I've put together for our home. This is actually the one out of our bathroom. But in our home we have 3 bathrooms, so I have 3 of these exact setups throughout the house. That way everybody in the house, my kids who are 11 and 10, they're able to know exactly where it is and if they get in trouble or if they need something, where to get it. Which brings me to another point: train your kids. However, it's not the point of this video. So let's get into it. Okay, so I have a 2-tier system here, and these are drawers that can slide out. What I do is I keep them under my sink in each one of the bathrooms. So every bathroom has that little cabinet under. We just take one of these and put it underneath. And we'll kind of go through how I do it and what my thought process is. So what I have is on the top I have the things that we're going to use the most. And then on the bottom, I have the things that are going to be used the least. More traumatic events down here. So up here, what I do is I go out and I get in one of the cases of assorted bandages. So this will have all of the bandages through it, if you can kind of see here. And the way it comes, it's pretty divided already, which makes it really easy to see where things are. We have our small Band-Aids. We have our normal 3/4 inch Band-Aids. We have our larger 1 inch Band-Aids. We have fingertip Band-Aids. We have the knuckle Band-Aids. We have the larger Band-Aids, and then a really large one, as well as these pesky little dot bandages. They're in there as well. They came, so I left them. So that's the first thing I have it's kind of in the back just because of where it sits the best. If you come up here on the side, now I have gloves. I have the largest hands. I buy the most gloves. I'm also the one, surprise, surprise, that takes care of most of the medical issues. So we have sets of gloves here. Right in front here, I have these 8-ply surgical sponges. These are what I use and what I've trained my kids and my wife to use as cleaning sponges. So this is where we're going to irrigate a wound, we're going to pat it dry, we're going to take and investigate the wound. These are what we're going to be doing with that. They don't have to be sterile, just clean, and they stay clean in here. These are just cleaning sponges. They're not going to be used to pack a wound or anything like that. Maybe if there's a longer scratch or something, you could put that over and wrap it, but just some 4x4 dressings. So next up here, you'll see this little cup that we have. In the cup, I do have some glue, some Dermabond that we'll use if we need to. I have some bacitracin. I have hydrocortisone. Now, if someone in your family is highly reactive to allergens or to, say, mosquito bites, hydrocortisone is always a great thing to keep on hand. Just a little dab on the wound or on the bite, and then a Band-Aid over it really helps decrease that inflammation response. I also have a silver-based antibiotic ointment. And then I have regular Neosporin ointment as well. Last thing I keep in my kit, this is a 20 ml irrigation syringe. It works really well for irrigating wounds. You can create a significant amount of pressure with that catheter tip on there. It's about the right amount of pressure. It works really well. And then on the other side, I just have different types of tape: athletic tape, micropore, and then silk tape that is in here as well as part of our kit. Now, if we go on section of this, which is going to be the more of the trauma section, we'll kind of start out at this side. I do have a single set of sterile gloves if I ever needed it. to close wounds or to do any bigger work, I have that available to me. I have 4 8x10 ABD pads, 4 5x9 ABD pads. I have some 4x4 pads. I have Vaseline gauze. I also have non-stick pads in here as well. I have crinkle gauze. Now crinkle gauze, people kind of tend to get confused between regular conformed or stretch gauze and crinkle gauze. So crinkle gauze, I don't like using in wounds because the little fibers in here can get into the wounds and they're very hard to clean out when we're going in and cleaning the wounds, versus the stretch gauze, which doesn't have as many hairs and fibers that can get in the wound. Really good for wound packing. But with the stretch gauze, it's not something that we want to put and wrap on the outside of wounds, particularly because as wounds start healing, there's some swelling that takes place, and that swelling can actually make this a tourniquet and cut off blood flow, and we don't want to cut off blood flow. So we typically use stretch gauze just for packing and crinkle gauze for wrapping wounds with. So I have 2 of those. I do have a 4-inch Israeli bandage in here. I have 2 rolls of Coban. I have my TMT tourniquet. If you haven't heard of a TMT tourniquet, or if you haven't seen my video on it, really recommend you go back and watch that. This is an amazing, awesome tourniquet. I have 4-inch ACE bandages, 2 of those, and 1 3-inch ACE bandage. 4 of the stretch gauze. And that's the end of what I keep in my home kits. This gives you ideas about what to do for yours. Until next time, live or die. It's up to you. Have a great day.